Charlie, thanks very much for that over-the-top introduction. I appreciate that very much. And one of the reasons I get to do so many things is when you're free, it's amazing how many things that you can do. But first, I want to thank Charlie and CED for hosting this. Second, for pulling this together. Roger, I want to thank you at TIAA-CREF for being a host again for another CED function. I want to commend Senators Wyden and Bennett for their leadership in trying to take a bipartisan approach to try to deal with this issue. The only way that we're going to achieve sustainable success, not just with regard to health care reform, but any major area of reform, is through a bipartisan approach. Clearly, health care is our #1 fiscal challenge. It's our #1 competitiveness challenge, arguably, as it relates to today. Over time, that might well be education. We're in a $53 trillion hole as of last September 30. That's 2007. $34 trillion was Medicare. It goes up $2 to $3 trillion a year even with a balanced budget, and we're heading the wrong direction on that. There's absolutely no question that the factors that cause the current mortgage-based subprime crisis exist for the federal government's finances. There are three big differences. Number one, the federal government's finances challenge is not quite as great. Probably not quite as immediate, but it's much greater. That's number two. And number three, nobody's going to bail out America. We're going to have to solve our own problem. We're going to have to engage in comprehensive health care reform, comprehensive tax reform, Social Security reform, spending constraint, and we're going to have to reimpose tough budget controls. And health care is the single largest driver to our fiscal imbalance. In my view, we need to take a comprehensive approach to health care reform that at a minimum focuses on 4 pillars. Universal coverage for basic and essential care that's affordable and sustainable over time, based on broad-based societal needs, not unlimited individual wants, and that avoids taxpayer-funded heroic measures. Number two, a budget for what the federal government will spend on health care. No other industrialized nation on earth writes a blank check for health care, and we can't either. Thirdly, national evidence-based practice standards to improve consistency, enhance quality, reduce cost, and dramatically reduce litigation risk. And fourthly, increase personal responsibility and accountability for our own health and wellness. We have to make sure that any comprehensive reform plan has the right incentives to promote the right behavior, adequate transparency as to cost and quality, and appropriate accountability if people don't do the right thing. And in my view, any health care reform legislation must save money. Must save money. Washington has not learned the 3 rules of holes. When you're in a hole, stop digging. When you're in a $53 trillion hole, you better have a plan to figure out how you're going to climb out. And you also better have metrics and mechanisms in place to keep from falling back in once you start climbing out. The time for leadership is now. I again want to commend Senators Wyden, Senators Bennett for pulling together the beginning of a coalition, and we're pleased to be able to co-sponsor this and other efforts by CED, and thank you very much for having me.